As data come in from dental caries research around the world, it has become clear that tooth decay rates in the developed countries have been declining dramatically over the last 2 generations. But that decline appears to have nothing to do with whether the water is fluoridated or not. For example, in Western Europe, 97% of the population gets non-fluoridated water, although 4 countries have fluoridated salt available. When you compare tooth decay rates in the fluoridated countries with decay rates in non-fluoridated countries, the graphs are identical. Something's causing tooth decay rates in the prosperous parts of the world to decline, but it's not fluoride. It could be a combination of better diet, better hygiene, or better access to dental care. Among poor people eating poor diets and with poor access to care, tooth decay rates are still high, despite years of exposure to fluoridated drinking water in many places. When the socioeconomic variable is allowed for, child dental health appears to be better in the unfluoridated areas. There has never been a randomized, controlled clinical trial supporting benefits of water fluoridation, as you'd expect to see for any legitimate therapeutic agent. Not only that, 2 important studies of water fluoridation in the United States, the largest study and the most precise study, both failed to show that water fluoridation could produce a clear reduction in decay rates. So why do dental and public health authorities tell us that the concept of water fluoridation is supported by thousands of studies? A large study was conducted by the National Institute of Dental Research in the 1980s, which collected data on 39,000 children in 84 randomly selected communities across the United States. The NIDR study was published in 1990 by Brunel and Carlos. They analyzed a cherry-picked 10% of the available data and reported that children who always lived in fluoridated communities had 18% less tooth decay than those who had always lived in non-fluoridated communities. But the absolute difference between the 2 groups was actually just 0.6 of a decayed surface. This was discovered upon further investigation, which suggested fluoride exposure was causing a delay in the eruption of permanent teeth rather than protection from caries. It was the monumental research of Dr. John Yamayanis that implied water fluoridation could contribute to the delayed eruption of teeth. Such delayed eruption would result in the presence of fewer teeth and therefore the absence of decay. This would mean that the lower rates of decayed and filled deciduous teeth, DFT, were actually caused by a lack of teeth as opposed to the alleged effects of fluoride on dental caries. Again, the source is J.A. Yamayanis, Water Fluoridation and Tooth Decay, results from the 1986-87 National Survey of U.S. School Children, published in Fluoride 1990. And IAOMT's position paper against fluoride use. Other researchers have further questioned fluoride's use in preventing tooth decay. Authors of a 2014 scientific literature review affirmed that fluoride's anti-caries effect is reliant upon calcium and magnesium in the tooth enamel, but also noted that the remineralization process in tooth enamel is not dependent on fluoride. In addition, the researchers wrote, quote, "Fluoride exposure has a complex relationship in relation to dental caries and may increase dental caries risk in malnourished children due to calcium depletion and enamel hypoplasia," end quote. The sources from S. Peckham and N. Awofeso, Water Fluoridation, a critical review of the physiological effects of ingested fluoride as a public health intervention. Scientific World Journal, 2014, February. Furthermore, authors of research published in 2010 identified that the concept of, quote, fluoride strengthening teeth, end quote, could no longer be deemed as clinically significant to any decrease in caries linked to fluoride use. The sources L.M. Tenuta and J.A. Curie, Fluoride, Its Role in Dentistry, Brazilian Oral Research, 2010. Even an article in the Centers for Disease Control and Prevention, CDC, weekly report included this statement, quote, "The prevalence of dental caries in a population is not inversely related to the concentration of fluoride in enamel, and a higher concentration of enamel fluoride is not necessarily more efficacious in preventing dental caries," end quote. The source is the Centers for Disease Control and Prevention, W.G. Cohn et al., Recommendations for Using Fluoride to Prevent and Control Dental Caries in the United States, Morbidity and Mortality Weekly Report, Recommendations and Reports, 2001, August. Significantly, in a 2019 publication, Dr. Philippe Grandjean of the Harvard Chan School of Public Health wrote, quote, "While water fluoridation continues to be recommended, the benefits appear to be minimal in recent studies of caries incidence. Consensus has since then been building on the lack of efficacy of water fluoridation in preventing caries. It therefore appears that population-based increase of systemic fluoride exposure may be unnecessary and, according to the evidence considered in this review, counterproductive." End quote. The source again is Philip Grandjean, Developmental Fluoride Neurotoxicity, an updated review, Environmental Health, 2019, December.